name's Joel Straz. I'm the health officer with the Bay County Health Department. I want to thank you for coming to our open house today for the Bay Community Health Clinic. I'm so used to calling it the University Clinic, but we have a new look. We have a whole series of accomplishments that we're going to show you today, and we're going to show you some part of the facility. One of the things here, this is a brand new room. This is the inauguration meeting for this new conference room. So we're very grateful for all the support that we've got with some of the rebuilding and the remodeling that we've had here at the health department. I don't want to spend a lot of time talking because you didn't come to see me. You came to see the clinic. You came to see our leaders. But I do want to say that this partnership with Saginaw Valley State University began in 2013 and accumulated in a first grant being awarded by HRSA in 2014, and it is one of my proudest accomplishments. And one of the things that we've seen and that we're doing here and that we know is that there are a number of people in our community that are really struggling to get care. And this was a great meeting of the minds with the health department, the university, other community players involved as well. And I think we're really making a difference, and we're seeing folks that have not been able to access care before. So I want to thank you all. I'm proud that you're here. We're proud to show you the facility so far. Pardon our dust. We're still under construction. But I hope that you'll learn a lot and see a lot of good things today. Like I said, I don't want to go on. I'm going to introduce you to Dr. Kathleen Schachman, who's going to speak, give some remarks about what we've been able to accomplish here.
Sure. Thanks, Joel. So I really wanted to illustrate some examples of what we've been able to accomplish with this partnership. And again, this is a partnership between Saginaw Valley State University, Bay Aranac Behavioral Health Authority, and Bay County Health Department. And I really wanted to focus on three areas. One was improving access to health care. The second is improving quality and safety of health care. And the last is lowering health costs. So I just want to provide one or two examples of each of those. So since opening in 2015, we have served over 1,000 patients, and currently just over 300 recognize us as their medical home. We've had considerable growth this year in 2017, and currently we're seeing between 10 and 20 new patients every week. And a lot of that has been driven, these are folks, as Joel indicated, who really didn't have health care before. And so that's where most of our growth is driving from. We do use telehealth to expand our reach up into Oscoda County, so we're further enabling access in some of these rural areas. Also, through this integration and partnership with Bay Aranac, we have faster and quicker, more expedient connections with behavioral health services for those who need help with depression and some other mental health illnesses. In terms of improving quality and safety, we did implement universal screening for depression, and that has helped us to identify a number of people who really go unrecognized with mild to moderate depression. And in most cases, we're able to see those patients and start to manage their depression that very same day. We also have improved clinical outcomes in regard to a couple of other chronic health conditions. Significantly, we watch and track hypertension and diabetes. And many of our patients come to us with diabetes that's very, very poorly controlled. And over the last year, we've been watching and trending some of our clinical markers for diabetes. And out of our 50 or 60 patients who have diabetes, there was only one who was considered to be poorly controlled. So we've really made some remarkable steps with how we manage and treat diabetes and hypertension. And then finally, the issue of lowering costs. We know much of health cost is driven by inappropriate usage of the emergency room. And that's one area where we've had tremendous success. In the past year, we have reduced inappropriate emergency room visits by 46%. We've also reduced readmissions for some of these chronic health conditions that I talked about. So that's the very real impact that we've had here at the clinic since we opened in 2015. Okay. Before I give the stand over to President Bashand, I do want to make some remarks to thank some people. Our partners, certainly Bay County Health Department, Bay Aranac Behavioral Health, Saginaw Valley State University, and also Blake Johnson and the faculty and staff at Cardinal Solutions, who have really helped us with this rebranding effort. And then finally, Dr. Sherry Kaufman and Tricia Charbonneau-Ivy, who really helped to set up this event today. So thank you.
Well, good morning. I met with Kathleen the other morning to kind of go over what I was going to do and what she was going to do, and it seems that she just did what I was going to do. So let me just say a couple things. We focus on community engagement at SVSU. We believe in that. We've been recognized by the Carnegie group as one of those universities in the United States, and a group of about 10% that primary focus is community engagement. This is a classic example of what community engagement is all about. You take your students, you take your faculty, you take your professors, and you develop a relationship with another agency that intends to do good things. And let me tell you something about these partnerships. I've been in a lot of them. I've been doing this a long time, and several of them have turned into be huge nightmares. They aren't a partnership because you call them a partnership. They're partnerships because they are partnerships. And relationships and protocols and territorial boundaries are very difficult to navigate. But what drives good partnerships is the commitment and tags that fall off by both parties on a long-term basis. So what we're involved in here is trying to help people. And the evidence that Kathleen presented to me in terms of patients served, emergency room visits that have been negated, mental health issues from people who don't have access to health care that have been dealt with, these are tremendous accomplishments. And for us, it's a win-win. I see my occupational therapy faculty here, nursing faculty, art faculty helping design logos and branding. I mean, this is tremendous opportunities for our students to do exactly what we believe in: learn and serve and produce significant outcomes. So I'm really proud of this relationship. I'd like to say thanks to my good friend Jim Barsha and his leadership in government. And Joel, you couldn't ask for a better partner than Joel. You want to put a complex problem together and build relationships, Joe's the kind of guy to do that. And he's done it. And of course, Kathleen and her, who's next, Judy Ruland. It's a great opportunity. It's a pleasure for me to be here. And I went on the early tour. And you know what? These people out here really know what they're talking about, because they took one look at me and they assumed I was their next client. So on that happy note, I'll turn it over to Judy Ruland. Thank you so much.
Well, thank you, him. Well, back in early 2014, when we came to meet with Joel and have lunch to talk about the possibility of our bringing a clinic to the Bay County Health Department, he was gracious then, and he's been gracious for the entire, what is it now, 5 years maybe? I might have my numbers wrong.
We're almost going on 4.
We're going on 4, but from the planning stages, I think it might be 5 years, to write the first grant and to go through all the planning and figure out how things could fit here, figure out how we could eventually get paid for services here. It's been a remarkable journey, and I thank you. And I thank all the people who are in the audience, and especially those of you who work here every week to provide the care here and to figure out all the difficult journey things that you've figured out in order to finally get services paid for, to find ways to increase patient care here, patient load here, so that this clinic can be sustained when we no longer have the grants to fund it. It's been a remarkable process, and you are remarkable heroes in that process. Over the past 3 years, 60 or more students in the FNP track have gone through a clinical immersion here, not just FNPs, but Masters in Social Work and Masters in Occupational Therapy students and pharmacy students from 4 universities have worked together to provide the interprofessional care that's here. Nursing, social work, occupational therapy, pharmacy, and health science have all worked together. I always leave out that Masters of Health Administration, but they're here. SVSU, Ferris, Wayne State, and Michigan State have all provided services in the clinic. The emphasis is on interprofessional education and interprofessional practice, instilling competencies to function as a part of a patient-centered team. And this is learning with and from other professions, because they have to do this when they practice, when they finish, and we allow our students to do this, not just at this clinic, but back at the university on a regular daily basis. When they come here, they get to actually practice in a setting that is unique, and we hear when we go to state meetings that it's one of the few that really, really practices, not in silos, but together as a team, and we couldn't be prouder. Over the past 3 years, significant improvements in knowledge, skills, and attitudes of the healthcare professional students that come here have been transformed, and they tell us that when they graduate. Students have gone on to, those that have graduated have gone on to impact healthcare across Michigan. They leave our program as emissaries to say this can be done, we did it as students, and it can happen in practice. The focus on integration of both telehealth and interprofessional education is resulting in national and international presentations. I can't name them all, but we've been to, as far as England, Ireland, is that right? Ireland this summer, Dublin, Banff, Canada, and then many, many national presentations related to the work that we do in interprofessional education. And people regard us as the experts in Michigan. They comment on the camaraderie that our faculty have, not just at this clinic, but in our college. And the clinic, the work that went into developing the competencies for the clinic have been shared with all of the faculty across the disciplines in our college. So master's and doctoral students have conducted research and implemented quality improvement projects to improve the quality and safety of patient care based on their work here at the clinic and other clinical settings that they've carried this knowledge to. So you all have set a wonderful example, and I can't wait to go inside and see the newest advancements. So thanks again. Thank you, Bay County. Thank you, Bay Aranac. And thank you for the Board of Commissioners of Bay County for having faith in us. Thank you.
So it's my pleasure to introduce the county executive of Bay County, Jim Barsha, my boss, who's going to provide a few remarks of his own here. Thank you, Jim.
Thank you very much, Joel. Joel, I have to ask you, you little rascal, did you send the same talking points to Judy, Kathy, and I? They did such an outstanding job, I think, hitting the highlights of what this partnership and this collaboration has meant, not only to SVSU, which allows the opportunity for students to get out on site and actually interact with the patients here in Bay County, the clients that need their assistance and their guidance in terms of getting their health back on track. But it's an absolute boon for Bay County to have access to highly educated and well-trained staff. While they may not have achieved their degrees yet, the collaboration with the excellent students and staff at Saginaw Valley State is a tremendous accomplishment for Bay County. And Joel, I want to thank you for your leadership. I was blessed to be able to inherit a program like this when I was sworn in January, and you have my strong commitment that we will work to continue to expand the services to Bay County, and you will have all the support that I can give you. And I want to mention another champion of the health department, and also someone who is a great commissioner, is Commissioner Mike Duranchek, and who's been introduced. But we couldn't accomplish anything without the support of the Board of Commissioners. They hold the purse strings, and they believe in what you're doing. And I know if some of you have a chance to get out into the rest of the department after this short program, that you'll see we're under construction, but it was something that was needed for a long time, and I think will serve the residents and the staff especially well for years to come. Kathy, I want to thank you too. I don't know how we retained Kathy, a PhD and a nurse practitioner. My God, you could write your own ticket and be anywhere in North America.
Where else is there to be?
I know. I also want to say how honored I am to be in the presence of someone that I've worked with and admired for much of my adult life, especially that portion when I was involved in public service, which has been a few decades now. With that is our great President Don Basham, the leader of Saginaw Valley State University. I was close to Eric Gilbertson and Don, who were a team. And we couldn't have had a better successor to Eric Gilbertson, who was the longest serving president of any state university. However, and he left big shoes to fill. However, Don Basham has stepped in, and the leadership that he's provided has been amazing. But it isn't new because he was doing it all along. Eric and he were a very tight team leading, along with Deb Huntley, the provost, and so many other great staff members and board members, Don, over the years that have, and I may be a bit prejudiced because I'm an alum of Saginaw Valley State University, but I think we have a world-class university there. I was vice chair of higher ed appropriations, and I had the chance to visit all of the campuses in Michigan, the four-year institutions, with the exception of Ferris and Western. But I am most proud of my alma mater. I think the infrastructure, the quality of the staff, and the tremendous faculty that we have teaching students. We're not just a regional treasure and asset, we are a statewide asset to Michigan. And Don, thank you for your vision for Saginaw Valley State and for continuing the great legacy of Sam Marble, Jack Ryder, Eric Gilbertson, and I know you will take Saginaw Valley to new and greater heights during your tenure in the years ahead. So I want to thank you for being included in the program. Most of what I was going to mention has already been touched on, but there are just a couple of things that I would like to add. I think Bay County is recognized as the only health department that is so integrally involved in primary care. And I think if we look at federally what's happening with the cost of health care and the struggle in the Congress about Obamacare and if it's going to be continued or if it's going to take another form or be eliminated altogether, that primary care should always be recognized as a key component of being able to control health care costs by delivering great care, quality care at an affordable cost, and also its emphasis on prevention of chronic diseases. And I think Kathy or Judy mentioned diabetes, and very preventable. Many other chronic diseases are preventable if people are educated and have the desire to stay and remain healthy into their latter part of their life. So we can control healthcare costs by your efforts in primary care and through our health departments and our universities and our public schools about educating people about if you want to live a full and enjoyable and healthy life, you have to adjust your lifestyle to avoid certain things, substance abuse and obesity and on and on. So I just mentioned that the recent county health rankings compiled by the Robert Wood Johnson Foundation have indicated that the ratio of primary care providers to the general public in Bay County is only 1 per 1,900. So that rate is far higher than our neighboring counties in Midland or Saginaw County. And we certainly have seen tremendous beneficial outcomes that have already been touched upon. Whether our local hospitals realize it or not, we are saving them a lot of money by reducing the number of and incidence rates of visits to emergency rooms, because that is the most expensive health care. And it also is traumatic for the patient when it gets to the stage that they literally have to go to the emergency room for health care because it's at a critical state at that point. And so there are a lot of benefits that are resulting. Also, that same foundation ranked Bay County in 2012 as 54th out of 83. In 2017, we are ranked 34th out of 83. So we're going in the right direction, and we hope to, the next time those rankings come out, be even higher up the ladder. Number 1 is best. Number 83 is worse, just so that. So what I want to do on a final note is just thank the leadership at Saginaw Valley State University, Bay Aranac Community Health, which has already been mentioned, which will help us address some of the minor and more moderate mental health issues that do cause a lot of societal issues and family relationships that are impacted. And that's a wonderful service, very expensive and unaffordable and unattainable for many residents throughout Michigan and the country for so many years. But this clinic would not be possible and its success and being recognized today were it not for the leadership, of course, of our great Director Joel Strauss and his very, very dedicated staff of Department of Public Health, Department of Health employees that we have right here in Bay County. And I've been here many times. In fact, last time was yesterday. And but we get over every couple of weeks. We like to interact with staff, and we need to know what the staff needs. And fortunately, we have a great line of communication through the director and the top staff here, as well as the employees, so that we know how we can make more intelligent decisions regarding policy as it impacts the health of Bay County's residents. So I want to thank Joel and the entire staff here at the Bay County Health Department for your dedication, professionalism, and obviously teaming up with, in my opinion, the premier university in our state. And then on a final note, recognize John Kaczynski, who's been a loyal friend and great guy and has helped the university in many ways by, in his government relations role at the university, reaching out and letting legislators at the federal and state level know, but also interacting with us at the local level about what might be done to help Saginaw Valley State continue on its mission to expand the good that it does in the years ahead. And I am so proud of that university. It is by far the most aesthetically pleasing, but beyond that, it is, I think, got some of the most quality factors in terms of its wonderful, dedicated staff and the amazing faculty that's been assembled as a team out there. So we are blessed to have a university of that caliber in our region of the state of Michigan. And then, just to be fair too, we have a great community college in Delta that really helps to integrate some of the educational process so that people can go right into the workforce by acquiring skilled trades, education and training and things like that. So my reflections today are we're lucky. I have no plans on going anywhere. I love Bay County. I was born here. I'll die here, as all of you, I think, have a lot. And I've already told Joe we got to try to sign him to about a 35 or 40-year contract because we never want to lose that guy. So thank you very much.
So I thank you all again for coming. We're so excited. We've put a little bit of work into this, and we're so thrilled to have so many providers here today too. So I just wanted to give you a couple notes on what we have planned for you. We've got a couple little goodies along the back for you. As soon as we finish here, Tricia, we're going to be running a slideshow. Thank you. And that'll run every few minutes. And so what we'd like to do is actually take you on a tour and show you some of the technology that we currently have in use and some of the ways that we interact with our patients. So we have a bunch of tour guides and white coats, and I've got staff here, and we'll probably go in small groups so we can have time to do that. Then we'll wind back through here. In the first patient room, we will be demonstrating a telehealth demonstration with some equipment that we use. In our second patient room, we will have our social work students be demonstrating what we call a universal screening that we do for all of our patients that screen for depression and mental illness and things like that. Our nurse practitioner students are in the telehealth room. And then you can see the patient, and then you can come around to where we all work in the nurse practitioner room and see it on the other side of the computer. So you'll see it from the patient side, And then you'll see it from the nurse practitioner, who could be anywhere, as Kathleen said, Scotia or wherever. So we have some things we'd like to show you there. We've got occupational therapy doing some paraffin hand baths, and we're just excited to share what we do. Occupational therapy, social work is all set up to talk to you about their role, which is really, really important here. And with the expansion, we brought social work into our group. Then as you come back here, I'm hoping everybody fills up some more, because I don't want to pack all the food up. Carrie will be demonstrating our brand new patient portal. And so the screen set up back here, you'll see how other facilities that you may be familiar with have a patient portal. Some of the larger hospitals and people have that. So we'd like to show you sort of our grand opening with that. They're example patients. We're not showing anyone's information, so just be clear on that. But we're very excited to have you. So our tour guides will probably kind of line up towards the back, and then we'll be bringing you back to this room. Blake and his crew last year helped us rebrand, because originally we were called the University Clinic and people thought it was a clinic for students. And they actually did, their course actually went out and they did some man-on-the-street interviews at Walmart and Meijer, and people thought it was for students. So we said, oh, okay. So they came up with some proposals for us, and as a staff, we voted on it, and this is the logo that we chose, and they came up with some brochures that describe all of our services, and talks about our interprofessional approach to care. So, very excited to have the new look.
Is that the one, that's an appointment?
Okay. Oh, okay. And then you'll see the signage as we go through here. So that's new as of a few months ago. So this is an example of what we would do at the clinic, where we do a process called universal screening, where we're screening for depression, drug use, substance abuse. And we have that all on a one-page sheet, and then as they go through and do an initial universal screening, if a patient scores high in an area that they're concerned about, the social workers will either immediately do a full screen, or we will try and forward them into treatment. And our statistics as far as getting people into treatment is amazing, since we've brought our own social workers on board. And these gentlemen both happen to be from Saginaw Valley, right?
Yes.
Okay, I'm gonna let you introduce yourselves.
I'm Andre, MSW intern here. I got my BSW at SVSU as well, so.
Super.
All right, and my name's Robert Mercier. I'm an MSW intern at Saginaw Valley with an undergraduate degree actually in music from Western. It's my first year in the program.
Yeah, I think these ladies might know your mom.
Oh, really? Do you get Lucy?
Yeah.
Yeah.
See?
Me too.
Yeah.
Yeah, me too.
Yeah, she's a great lady.
Yeah. So do you want to just kind of go through and ask our patient some of the screens that you're
Sure.
using?
So with the PHQ-2, we use it to evaluate levels of depression. So it starts out with the 2 questions. So if there was a visit, I would say, hi, how are you?
Hi.
All right. So what brings you in today?
Back pain.
Okay. So it states that he's having back pain, and so with that, I would try to ask the questions of pertaining to the PHQ-2. Do you have any interest and pleasure of doing things?
I like doing a lot of things.
Okay. Do you ever have any feelings of being down or depressed or feeling hopeless?
Not me.
Okay. And so with his answers he gave, he scores low on the depression threshold. So there will be no need to go on to the PHQ-9, which will give, I guess, deeper questions and and identifying whether or not he has a high or low level of depression. So.
And then we also screen, we do a very brief screen for substance abuse and, right, on your tool there. So we do the initial and then we can refer them right into treatment like Kathleen said. With our social workers on site, many times we can refer them the same day and we can do that expanded screening. And even if we can't get them in to see someone today, within a week or two is usually as long as it takes us. It really, our numbers have really gone down for time. So, okay? We have a lot of students, like we said, from the different universities, and we recently had a chance to do a presentation about our interdisciplinary clinic.
Yes,
and I think that might be you in there, Dean Gerlin. So
You're absolutely right.
yes. And then our pharmacist was honored as a preceptor at that conference, the MyPerk conference. So, yeah. So this, we've kind of just gotten all the new signage, new looks sort of here in the last couple months here. And Emily, tell them what you do.
So what we're working on is trying to help people manage some of these chronic and sometimes acute illnesses that they're also working with the other disciplines on. OT-wise, we really want to get into their lifestyle and get into their homes, get out in the community with them and see what we can do and help them outside of exercise and modalities, but help them manage what they're working with. Because especially if it's a chronic condition, we want to help you adapt or compensate or be able to live your life the best way you can. And sometimes it's something physical, sometimes it's something emotional or mental, or it's meal planning, it's medication management, whatever we can do to help their lives be better. So.
And actually for the patient we were just in the room with, Emily is going to go in and see him. He recently had a back procedure and is wearing a brace, and she's got some equipment here, and I think he may have brought some in too that you were going to work with him on.
Yes.
So, yes, we're so thrilled to have that.
Yes.
Yes, and we have the paraffin bath here too, on our way back.
So Andrew, why don't you give the intro?
Sure. What we've got set up here is one of our telehealth systems. Right now we are kind of conferencing with a patient assessment around the corner over in the exam room. The camera in the center is actually one of the tools that we have. It's a digital otoscope, so we can do an internal ear exam.
I just turned it on.
Rachel? Hello? You want to grab the dermatoscope and take a look?
I'd love to.
Excellent, thank you. A couple different tools that we have. We have the otoscope, so we can do the ear exam. We have the dermatoscope, so we can do a close-up skin assessment with moles, lacerations, any kind of skin condition that's going on. And we also have an iriscope. It's kind of like an eye cup, and you can do an external eye exam with that. Something that we don't have hooked up today, but we do have is a 12-lead EKG. And then there's a number of tools that we're looking at getting from VC yet again.
So come closer.
So yeah, so you can see it. We didn't have a screen available, but yeah, you can see just a mole there.
Yeah.
So
and the beauty of all of this is we can actually send these images to anyone with this software that has an internet connection. It's all HIPAA compliant. One of the cool features with the EKG is you can actually have the rhythm strip right up in front of you sent to a provider who's also looking at it at the same time. And the applications for the software are quite broad. We can have social work consult with whatever we're doing. We can have OT take a look at range of motion, doing their assessments from a distance. The setup we have over in the other room is actually our mobile setup, so we could actually do a home assessment. So where social work, OT are involved, where nursing is, like if Dr. Lee's back at the clinic, having to do a follow-up with, so the potential for collaboration here and interprofessional collaboration is very broad.
So I'm one of the social workers, one of three. There's me, Ian Brand, and our supervisor, Sherry Lemire. And so what we do is we do a lot of things. We do short-term case management, we do outpatient therapy, we refer people to services, crisis intervention, whatever the client might need. We usually are the first line of defense. We go in and see them first, and then the MPs will come in. So we get the story first, and then we collaborate with the MPs or whatever else they might need.
We come back and do our curbside consult. We start with our huddle in the morning, and we usually, that takes place in this room, where all of the providers that are on site that day talk about who's coming in and what is our plan, and sometimes our plan changes, as we saw from our conference presentation, that things change. And so we have a lot of people that help us stay informed, and then we adapt. So
we're very good at that.
we're very good at that. So okay, Saginaw Valley's new rural residency program, and so since we had this opportunity, we just wanted to share some Saginaw Valley initiatives too. So this will be the new program the students just started in this fall, and it goes over the 3 semesters of the NP course. So I'm not sure if you all are familiar with that, Jean and Ellen, the rural residency program. So
the newer grant.
Yes, and so so we'll be using telehealth to help see that. We're doing more skills labs and things like that, so they're better prepared because they have less resources out in the rural areas. So she's working on that with Jessica is our clinical coordinator for that, and then Tammy Hill too, because she had connections at the clinic up in, now it's going to make me forget, Sterling, thank you. I knew there was an S, but it wasn't Standish.
I remember.
That was fabulous. That was fabulous. So that is the newest actors that actually had been previous substance abuse clients. And so we presented our students with an opportunity to do some online training. And then we brought them in, and they could do a face-to-face simulation. And so we did that. It took. They were there for an 8-hour day. We did 2 different days. So we have classroom instruction. We did some computer recognition, and then we did the online. And our students, by far, thought that was one of the best simulation events that they had. And when we look at lessons learned, we did develop a little laminated resource for students, because each one of us, when they say like, well, I have a glass of wine, well, really, is your glass of wine like this, or is it one of these? You know, so we all have to be on the same page. So lessons learned, we got a lot of great feedback from the students. So as far as the outcomes that we've recognized with the clinic, and the period for this outcome poster is actually just in the last year. So we talked about decreasing our emergency room visits. We talked about having improved outcomes for our patients with those chronic diseases like the diabetes and the hypertension. We really use a holistic interdisciplinary approach, and we really have the ability to actually practice that. So we're very excited about that. Our objectives were to, that you heard about, to come into the community and partner with several different organizations. And we really feel like we've been able to do that, especially with the addition, the latest edition of the behavioral health that has been huge for us as nurse practitioners, nurses, medical assistants. They really have provided some great guidance for us.
With health administration students is to expose them to process improvement initiatives in a healthcare setting. So we constantly have problems in current situations, especially as the clinic was beginning to start up. We had to choose an electronic health vendor, and so that was a problem, but it wasn't a quick fix. So we actually used another tool for lean process improvement called an A3 board, and also project management software to map out who's doing what by when, what things have to be done, what can be done concurrently, what can be done as a predecessor. so that we can track the progress of a job as big as choosing an electronic health record. When we get into reimbursement issues, we're often trying to map out the process as far as how can we get maximum reimbursement. We're currently working on getting us achieved as recognized as a patient-centered medical home. That's going to provide not only make us very attractive to healthcare organizations to want us to put us as a primary care provider, but also on the reimbursement aspect. Once we achieve that, there's like 40 competencies that have to be assessed and attested to in that process, along with 25 electives. So because of that, it is a long process. It'll take about 6 months, but we're actually using project management software again and lean performance improvement initiatives to map it out. What we did here is we recognize the individuals who spot the issues and bring it to our attention. So we have an ELI, or Everyday Lean Idea Originator, and then they might not be the ones that can help to come up with a proposed solution or a countermeasure. We really don't call them solutions because with PDCA we're never done. But we'll actually take and look at an owner to see if they can help us get us into the green. Red is process improvement initiatives that may not have started yet. Yellow are in the works, and green are ones that have been accomplished. We celebrate success when people bring these issues to our attention. So one time we had a big cookie and we had a lean queen. So, you know, really trying to promote the ability to always constantly improve processes. So that's all about lean, Six Sigma initiatives, and how can we use this real life laboratory to assist them with process improvement initiatives.
Dr. Lewis, well, I guess we can go Monday through Friday. It'd be easier for me to remember. So everyone is currently an instructor, I think, at Saginaw Valley. Chris had been, and I'm not sure if she currently is. I didn't ask her.
She's functioning here as an instructor.
She's functioning here. So all of these people are functioning instructors here. So on Mondays for the clinic, I see patients. On Tuesdays for the clinic, Dr. Lewis sees patients. Wednesday, Dr. Schachman. Thursday, Dr. Lee, and Friday, Chris Chesney, and that's our latest edition, and we just started that in September. We expanded our days to Monday through Friday. So we see patients, as Kathleen said, we see 10 to 20 new patients a week, which is phenomenal. So to get in for us for a new patient appointment, you might only be looking at 2 weeks versus...
How many total patients do you see a week?
Well, we usually have been scheduling at least about 10 per day, so 10, 5 days a week.
Wow,
yeah,
that's great.
Yeah, it's really picking up. We still kind of struggle with transportation issues. We use the bus system here. A lot of our clients do. But that is always a concern, transportation. So we do see a significant number of patients that are no-shows, we call them, based on whatever else. This allows them to come and do all their appointments in one place. We have a lab that's right down the hall. So if I order lab work, I can have the staff walk the patient right down to the lab and get that while they're here. It's really an amazing group of coordination. Kathleen and myself and one of our other nurse practitioners out of state actually served as the telehealth nurse practitioner. So the patient would come into the AuSable Health Department, and then we would log in from here or home or the university, and we would be able to actually see what the nurses are doing. And today we're fortunate enough to have 2 of our very own Saginaw Valley nurse practitioner students. So we wanted to we saw the other end of it, so now we just want to have you show them the equipment.
Yeah. So for the dermatoscope, the right one. I mean, actually, it looks just the same on the end that you saw, that I see. It's nice because, you know, obviously I get to pick what lesions I want to look at, so I have the benefit of seeing it both ways.
So this is where you guys were. You're in this room, obviously, with me, and then this is what we're looking at.
So and then I can just focus on what lesion, to kind of see how are the borders, is it something that we should worry about.
And then the nurse practitioner at the other end is diagnosing it. Right?
Correct.
Okay.
Correct.
Great.
Yes.
Good.
And then they're able to hear and see me over this way. So if on the other side Andrew was like, you know, I need you to move down, I need to be able to visualize this a little bit better, I'm able to do that, focus. It's been really, really nice to kind of be able to pick their brain that way too.
Now we have noticed that with some of the functions of telehealth, in order to really hear the heart sounds and lung sounds, we need to wear a headset. But this is the simulation system that we're using at Saginaw Valley and just borrowed it here for the day.
All right, so here we have our dashboard. When a patient pulls the portal up, this is the first page that they will see. And on here we have an appointment reminder. So this patient, which is a fake patient, has an appointment today at 1 p.m. And they can see that current medications that they are taking. They can request a refill from this screen. And they can view all of their medications, but for training purposes, we only have the one medication in here for this patient. They can see where their recent referrals are to. They can request a new referral. They can view all the referrals if they have multiple. This feature here is the lab results part of the portal. They can see the lab results, and if they click, they can get the actual lab report. And the lab result here. So this is something that patients are also able to print. And then back here, if we go to the left panel, basically the links to things from the dashboard are listed here. The immunizations history is not yet loaded to the patient portal. My account lists personal information that patients have the ability to change features, change their information, add their emergency contact person. Additional information, they can select which pharmacy they are using, and if they have a different mailing address than what is listed in our system, they can add additional contacts here. They have the option to reset their own password. The statements have not been yet loaded to the patient portal, but once that is available, their statements and balances will be listed here. The patient does have the option to message the clinic with questions or general information that they're requesting. They have the option to have their medication refill, the message sent to the practitioners. So they would request a refill here and select that pharmacy hasn't saved yet. And they have to answer a couple questions and then submit, and it goes right to the practitioner's Jelly Bean on their eClinicalWorks tablet. They can request to have lab results completed, which will also go right to the nurse practitioner's tablet. They can request a referral, and then from the screen they can also view, like I said, the current referrals. And then ask a doctor. The patient can send messages to the clinic that goes to a general mailbox that is monitored. Appointments, they can view their upcoming appointment, make a new appointment, request who they want to see, the reason for their visit, and appointments that they've had in the past. Obviously, this patient hasn't had any yet. Questionnaires, the medical history one is not yet loaded to the portal since we have just been active since October 1st with this. They do have the option to fill out their surgery history, surgical history, hospitalization history, and their allergies and their reaction to the medication or if it's a food allergy. The health tracker section gives reminders. Like I said, this is a fake patient, so no HIPAA violation, but this fake patient does require a drug screen and a couple different immunizations. Practice details up here on the right gives directions to our clinic. Pulls up Google Maps and lists us right there. So, and if you press the home button, it takes you right back to their dashboard, which gives the reminders.